This is Vanessa Johnson. I'm with the National Association of People with AIDS, and I had the opportunity to attend the National HIV/AIDS Strategy Implementation meeting with the United States Health and Social Services Office, HHS. I believe that's what they call themselves. So anyway, it was a great meeting. There were people from all over. Actually, it was a community meeting, so a lot of the national organizations were present. In terms of representation of PLWAs, we had Pause Magazine there. We had a couple of consumers who were speaking on their own behalf, one from Ohio. I can't remember where the other ones were from, but they were speaking as well. Bambi from Los Angeles was speaking on behalf of the transgender community. Ed Taphorn, I believe that's his last name, was speaking on behalf of the Asian Pacific Islander community, and then there was someone speaking on behalf of the Native American community. And I was speaking on behalf of the National Association of People with AIDS, and I made 3 points. One, that we need to reframe prevention with positives. That we need to think about people who are living with HIV/AIDS as partners in prevention rather than as people who have to sit through a whole bunch of interventions to reduce transmission. That is important, but that's not all that we have to offer in the field of HIV prevention. For example, we have a lot of leadership development programs which have gone a long ways to developing the leadership of people living with HIV/AIDS, which enable them to disclose, which have enabled them to raise their own self-esteem, and an unintended consequence which has enabled them to go back to work. A lot of folks, after they leave these trainings, want to contribute something to their communities and to society in general. So we've asked, NAP was advocating for a national consultation involving all the national organizations that represent people living with HIV/AIDS to sit down with HHS and to talk about how we can reframe prevention with positives. So we are really truly in partnership with them and playing a significant leadership role. The second thing we talked about was back to work and how we need to watch the tension that might be created unintendedly by the Social Security Administration's possibly implementation of the guidelines laid out by the Institute of Medicine's report on Social Security eligibility. I mean, we have to figure out ways in which PLWAs can go in and out of work and disability, because for some folks that's a reality. Everybody is not going to work straight 365 days for 10 years. They may be all right a period of time and not all right the next, and it's got to be a way that they can seamlessly go in and out of both systems. The third thing is we got to really deal with criminalization of HIV/AIDS, because all the work that's being done by the federal government and eventually by the states and local governments will be for naught if people are terrified of getting tested, and terrified because they think they may be prosecuted for unintentionally transmitting or unintentionally non-disclosing or disclosing and they can't prove they disclosed. So one of the things that NAP was is advocating for is alternatives to incarceration, because it costs less to educate people to incarcerate them. So if we really are talking about spending our dollars effectively, then we want to educate people, because it's been proven in research that many people who, once they know about their illness, will take the precautions they need to not only take care of themselves, but everybody else. Those are our positions.
Thank you.
You're welcome.